Thank you all for joining us for our second edition of our Lunch and Learn FLaNET webinars. My name is Tamia Tova. I'm a research project manager in the neuroendocrine department at Moffitt Cancer Center and one of the directors on the FLaNET board of directors. And then here we have Michael Austin, who is one of our social workers in the GI department. He's been in the GI department for about a year now, has had about 5 years of experience in social work prior to this, mainly in child welfare, and currently our main go-to in the GI department for neuroendocrine and other cancers as well. And then we have Jennifer Hubbert, who is from Fort Lauderdale, Florida. She's one of our neuroendocrine patients' spouses, and so she's going to be representing the caregiver portion of this conversation. And her background, she's a real estate agent over the past 20 years. She has several investment properties with her husband, Brian, rock star partner, and really very knowledgeable in the space. So welcome. I'll let you guys introduce yourselves.
Yes, like Tamia said, my name is Michael. I am one of the social workers here in the gastrointestinal clinic. I have been here for a little over a year now. I was an intern, and then I was really glad to be hired on. I'm currently working on my licensure. And yeah, I enjoy working with patients. I have a family history being here at Moffitt as well. So that kind of drew me here. And I'm looking forward to this conversation.
And my name's Jennifer. Like Tamia said, my husband is a patient at Moffitt. He was diagnosed in 2017 with neuroendocrine carcinoma. I also went through a battle of my ex-husband having leukemia. So we have 2 kids. And they went through both this progress and my ex-husband's also diagnosis as well. My ex-husband passed away in 2017, and in the same year, my husband now was diagnosed with NET. So it's been quite a battle navigating through all this. But it's always important to us to keep everybody involved. And we do our best to share diagnosis with our children, keeping them in the loop. And like Tamia said, I'm a real estate agent in Florida, South Florida. And hopefully I'll be able to help, all of you out there to go through and to navigate this medical progress, and help throughout the way.
Thank you. I think one of the reasons that we picked this topic as one of our earlier sessions is most of the time when we have these patient support groups, patient advocacy groups, a lot of the focus is on the patient, the provider, the treatment options, things like that, but not so much a highlight on the caregivers and how the diagnosis is going to affect really everybody around the patient themselves. And so the other portion that we would like to touch on today is the social work aspect, which a lot of times when you hear social worker, we're thinking hospice, we're thinking end of life. That's usually when they're looped in, or when there's a problem, right? Either a patient has a grievance or has an issue with a provider or with something that happened, or a financial burden, things like that. But there are other resources, and I don't think they're as talked about or as highlighted. So maybe we'll start with you, Michael, if you can kind of give an overview of what a social worker really is and what resources you have besides and including the most highlighted topics that we think of typically.
Sure, absolutely. Yeah, so first and foremost, the role of a social worker here at Moffitt is to provide emotional support to our patients. Say patients come into clinic, also for families as well. Come into clinic, you're feeling distressed or just needed to talk or discuss with somebody. That is our first role, was to come and kind of talk with you and listen to you and see how we can help, and try and have some wraparound services for whatever needs that you may have. Um, we do assist with the things, concrete needs such as transportation, lodging, home health, durable medical equipment, but that's more of a secondary role. Um, Really, we can be the go-to, for whatever questions that you may have. If I can't answer them for you, I'll certainly find someone who can. But really, we're just to be there in those moments of need for you, and make you feel like you're not alone if that's how you're feeling. Um, that's specifically what our role here is in social work at Moffitt.
And Jen, uh, from your perspective, what are some thoughts or what times that you felt like you needed more support, less support in navigating things? I think, you mentioned your ex-husband, you've got Brian right now. How do you feel you've navigated either the beginning of when you hear about a diagnosis to kind of when a patient's on treatment, and then, when complications come up in between? What's your perspective on that?
Well, I think overall we've been really blessed with, our care at Moffitt. I feel like we have a very good relationship with our doctors, with Tamia. Everyone there has been extremely supportive throughout the way. We also, are involved in some groups to help us navigate throughout this. They, it helps to have a good support group, and that I think is number one. And so also involves family, friends, so I think having that overall group surrounding us really helps us along the way to feel at ease at times, because the word cancer, you hear it and automatically you go into a panic mode. And we've had some pretty good success at Moffitt through all our treatments and everything. We just recently had a little bit of a scare. We're navigating through it, and we're able to have this great group behind us to support us along the way.
What do you feel like the most what type of support are you looking for usually from, let's say, your family, and what things are not as helpful in navigating that? And same thing with support groups, or kind of group therapy, group treatment, things like that you've encountered.
Well, I definitely think it helps to hear people's backstories, no matter what. I mean, we all are going through this together. You always kind of know somebody that's going through cancer, has gone through cancer, has experienced cancer through family, friends. So to know that you're not alone is probably one of the most important support things you can have behind you. I would try to weed out the people that kind of are toxic and feel like they know it and know it alls to everything. They kind of get in the way of things, and maybe not the best people to back you up in the process. But having the support groups have been extremely helpful for us. Therapy has been helpful. Different methods to get us along the way. I like to work out. That helps me get through the day. Other people like to do yoga, meditate, but being able to find your niche really helps, get through it.
Michael, what do you think, or what have you seen from your experience, and things that you feel like are helpful or not helpful? And Jen mentioned boundaries and kind of surrounding yourself with the right people. What are things that you feel like you can identify in your interactions with patients, and how you can kind of guide things in the right direction?
Yeah, I think what Jennifer said was pretty spot on. You want to make sure that you're surrounded by by people who are going to be positive for you, and finding that time to find your own coping mechanism, coping skills. You know, yoga is good, but it's not for everybody. Support groups are great, but that's also not for everybody. So really looking inside to seeing what are those things that are going to help you, no matter what anybody else says, because it's really for you, right? I do see that patients, also caregivers, do benefit from the support groups that we run, and also support groups that are outside of Moffitt here as well, to give yourself that sounding board, and also to have other individuals that aren't part of your close circle as well, right? We want to see what other people outside of our circle are doing and dealing with, and it might give you other ideas. And I'm a really big proponent of talking, right? I think talking is how we get things out. And it also can make us think and open ourselves up to more ideas of how to manage and find more coping skills and mechanisms and things that will help us get through our days, because every day is different. Not all days are good. Not all days are bad. But in having those things in your tool belt, I think are very helpful. And like I said, however you feel you need to do that, obviously, if it's something positive for you, that's for you.
And how, that's one thing when it comes to adults that you're dealing with, right? And drawing boundaries with them. And a lot of times yes, you can make very clear distinctions, and over time realize who needs to be there and who doesn't, things like that. You also have, most of the time, we were talking briefly before, kids, right, that are involved in this conversation, and how to, depending on their age, I guess, is what kind of conversations are appropriate, when to talk to kids about what's going on. I'm thinking of younger kids at this point, not older kids. So a couple different things that maybe we can touch on. So one is the younger population. How do you deal with those conversations, and when to bring them into the hospital, maybe so that they see what's going on, and when not to. And then with older kids, how do you balance that, and kids and partners, I guess, with the autonomy factor for the patient, and having them be there as a support, but not necessarily knowing when to kind of draw the line when things are becoming a little bit too much for the patient. I guess your perspective, Michael, and then Jen, if you want to touch on that as well.
Yes, certainly, especially for younger children, right? Infancy, toddler, preschool age, they don't necessarily know how to use their words, so to speak, right? So we want to make sure we're looking for different behaviors of them. Toddler, infancy age children, they're maybe are throwing more tantrums, they're changing their sleeping habits, they have separation anxiety. We're looking for those things. And for the older children, you might see regression, or for teenage children, right? Say dad's too sick to go take them to soccer practice. They might be angry. And then they're also having that battle of wanting the autonomy and the separation of being a teenager and trying to find themselves, but also wanting to be included in their family, and, not feel like they're being, mean to their parent or what have you, because they're not wanting to be close to them. And I think with all children comes that fear of the unknowing. Same with adults, but you know your children best. So I think you would know the appropriate time to want to maybe bring them in or have those conversations with them. And certainly we have resources that we can provide to help you navigate those conversations and those difficult times with your children.
Cool.
For us, it was, when Brian was diagnosed, my kids also lost their dad that same year. So it was important for us to really keep the kids on a schedule and not change much in their lives. I know there were times when they didn't want to do stuff, and my daughter was just graduating high school and my son was in 7th grade. So it was going through two very different age groups, but we really focused on keeping them active as much as possible, trying to keep their schedules the same, because I think once they get off that schedule, then they tend to gravitate towards things that may not be the right choice. So yeah, so we just worked on that, and you know, just gave them a lot of support, got a lot of family involved. You know, when there were things that their dad or Brian couldn't do, you know, we made sure family got involved, helped them, take them to their sports, their events, but really kept things pretty solid throughout the way.
What did you feel like was the most, I mean, that year was probably rough, if of anything, but what was the most difficult part of all this for you?
You mean
I
with the
guess that's
kids?
it. Well, not necessarily with the kids, for you specifically. What is the hardest adjustment, I guess, for you, and what do you find works besides just support groups and things like that?
I think the hardest part is probably just changing a lot of the things that I'm accustomed to in life. You know, the work that I do, you know, involves being out in the field. And so that was a lot of getting people to help out. And, you know, luckily I have a good boss. So when I have to take Brian for treatments or things like that, he steps in and helps out. You know, that's the hardest part, is probably just changing my schedule to have to, you know, to be there, to be a caregiver, you know, and to support. You know, that comes first, then everything else just comes second. And I think that, you know, it helps your loved one get through it easier than, you know, and showing the support throughout the way is important. So that's the hardest thing, probably just changing my schedules around. And you know, we don't live close to Moffat, so that was, you know, having to, the logistics of everything is sometimes gets a little bit hairy, but we make it work, and Moffat helps us along the way, coordinating things. So
Michael, I'm sure you hear that a lot, schedules for both patients and caregivers. And what's your experience with, you know, it's great when you have a great boss and it works out, but that's probably not always the case. What's your advice and kind of your resources or thoughts on how to navigate those issues, which will inevitably come up?
Yeah, absolutely. There's always going to be logistical hurdles, so to speak. I think Jennifer kind of hit the nail on the head with really using your resources and your own support system, right? Lending, you know, asking for that help when you need it. I know it can be hard sometimes, but you know, when it's all said and done, whatever you accomplish, I think is going to feel much better than that hesitancy or the scaredness to maybe ask those people around you. That support system is so critical and crucial. Um, I think for success, just in general, right? Having those people around you, being able to utilize them as needed. And I know it can be hard. You can maybe feel like it's a burden sometimes. But you know, being just totally open with yourself to ask those questions or ask those favors of those individuals in your support group can, you know, really change outcomes and just absolutely make you feel like you can get through this using those people around you.
What do you find are the most common complaints or questions that you get asked? And not related to this specifically, but in general.
I get a lot of questions concerning things such as really a lot of concrete needs, right? I think in the beginning, people want to know, you know, how they're going to get to where they need to go, financial things such as resources, you know, because people are debating if they can continue working or not, or sometimes they just can't continue working. So trying to get all those basic concrete needs kind of settled first, so then you can kind of continue to work on the other psychosocial issues that you may or may not be facing. But yeah, in the beginning, it's a lot of those concrete needs of, you know, who, what, when, where, why, how, what am I going to do? Who do I talk to? How do I get this? Who do I talk to about that? Um, those are a lot of the questions I get. And then secondarily to that, more of the internal questions of, you know, how do I cope with this? Who do I talk to about these things? Is it appropriate to talk to? whomever about these things. And I think asking for help is probably the hardest step, especially for individuals who have maybe even very independent their whole lives, and now they're having to rely on other people, which is a very life-changing adjustment to illness situation, and where I think those are some of the not so concrete hurdles that some of our patients face in this whole cancer journey that they're on.
And I think one question I get a lot is, what's the difference and what's the role of, there's supportive care and then there's home health, for example, that can help with things. And then there's hospice, and understanding the difference between those things. And also understanding when each of those services is appropriate, whether you can kind of jump in and jump out of any of these things, whether it be support, home health or hospice, things like that. I think there's a lot of confusion and also fear around those conversations, right? Because we hear hospice and we think this is the end, which it usually is most of the time. But can you kind of clarify that a little bit and touch on your perspective on that?
Yeah, so starting with home health, it could be something for quote unquote simple, for something like physical therapy, occupational therapy, right? Whereas we will set those things up for you if it's ordered by the provider. Social worker, case management will assist in doing that. The hospice aspect, and even with any of these services, right? You have the right to disenroll in them whenever you feel, right? So if you enroll in hospice and you feel it's not for you, or you feel that those services aren't what's needed at that point in time, you can certainly disenroll. It's not a forever thing. We have patients that come off of hospice. And then they re-enroll at a later time. Again, it's what your comfortability level is and what you feel that you need as far as those services go. And when we do get consults for those things, we do spend time to explain what these things mean to patients, because it's all very new to them. Typically most people have never had a home health for anything, right? So just explaining what that process is and what that looks like, so they have a better understanding of how that works, and kind of giving them that little bit of time to process it. Especially when I'm discussing hospice, I like to give all the information, as far as what agencies, how that enrollment process works, who is involved. Let the patients kind of sit with that, and I tell them, you can take as much time as you need to review this with yourself, with your family, with whomever you're close to make this decision. And just making sure that they don't feel rushed in these decisions, and they have a full picture of what these things look like.
Jen, I think you've recently gone through the home health, PT, OT, that kind of new thing that you had to navigate recently. And so if you can talk a little bit about your experience and what were the hurdles that you felt you had to jump through? I know you had to advocate a lot for yourselves in that. So maybe talk a little bit about that for everybody here.
Yeah, so recently we have been involved in PT, OT, and speech for Brian. Our first inpatient was in February, where he was in a rehabilitation, and that was totally like crazy, because we've never experienced anything like that before. But it definitely helps. I could say that was remarkable results from that. And we continue to do it now at home. Well, actually outpatient home, but I would say definitely take advantage of all the therapies that you can get, and anything that you're entitled to, take it, because it only benefits the patient. And it benefits you in the long run too. As a caregiver, you want your spouse, your loved one, to do the best they can, and sometimes it's very challenging for them. And sometimes it's rewarding too. You see, we've been through quite a battle, but we've also seen major milestones and outcomes that have benefited along the way. So I would definitely take advantage of it all if you can. You know, if your insurance provides it, do it. And it's baby steps, you know, sometimes it's very disappointing and sometimes it's scary, and, you know, they really help along the way.
Is there anything that either of you have that, that you want to touch on before we open up for questions in a dialogue with everybody here?
I would just say, don't be scared to ask for help. You know, I think for years and years and years and years, I was always like, I need it, I got it, don't help me, I can do it. I've always been like that my whole life, um, so it was very hard for me in the beginning to ask anyone. And then once I did, I was like, wow, this is great. And get everybody involved. I mean, I had someone the other day on another group tell me that she's an older woman, probably like in her 80s. Her husband's going through hospice. And she said on the group the other day, it struck me, that she does not tell her kids how hard it is to take care of her husband. And I felt like that was just heart-wrenching. It just like, wow, you should really get your kids involved. They should see how hard this is. They should see how maybe you'll have a good day one day, and maybe you'll have a terrible day. It's okay, because sometimes one day they might have to go through this. And you don't know, you never know when it's going to happen, and I think having, especially your mom telling you, listen, you're going to have your good days, you're going to have your bad days. And I think it'll help anyone, because they don't know what to expect. So involve everyone that you can, especially your loved ones.
Makes sense.
That's my advice.
Yes, I would absolutely echo what Jennifer just said. Ask for the help. Ask the questions. If you don't know those answers, or if you're just confused about something, and take advantage of all the resources and services that are out there. This is an instance where I do think more is better. And if you don't ask, you'll never know. And I wouldn't want to hear a patient or a caregiver say, oh, only if I had asked this or done this, not thinking about what could have done, making sure that you're utilizing every opportunity and all the resources that you can to have at your disposal. You definitely would want to have, an arsenal of everything that you can to, continue this journey and continue to fight as you see appropriate. But again, yeah, you utilizing all the resources that are available to you and asking the questions, I think is just very, very important to be involved with everybody. And if you feel like you can't advocate on yourself, try and find someone else. And then also what Jennifer said about her caveat about her other person in the support group, how her children don't know how hard it is to do that day to day. I think having people see that really would open their eyes and really see how hard it is. And it's not just you're not just there, you're not just doing those things. It's takes an emotional toll, and sometimes you do need to tag out and have someone else help you. So yeah, again, just ask the questions. Don't be afraid to ask for help.
Thank you. I think that's we'll share any resources after the fact. I'll post them along with the webinar link up on our website. So that'll be there. If you don't know who, I think most of the people on here are patients, and so Michael is our point person at Moffitt. But of course, if you're at another facility, if you're inpatient, your social worker will be different than your outpatient social worker, things like that. So just ask. And your social worker, this happens a lot for us too, is you'll pull them in and then they'll direct you with where you need to go. So if they're not the appropriate person to be handling what it is that you're asking for or that you need support with, they will know where to get you to. And so that's a key thing, I think, as well. We like to leave plenty of time on these for questions and just open discussion. So anybody that's on here that has anything to add, feels like they want to comment on anything we talked about, or just wants to share anything on their end, please feel free to unmute or type in the chat. turn your cameras on. It's whatever you feel comfortable with. Very informal setting, guys.
How do I get in touch with Michael's group to talk to somebody there?
We can put you in touch with them.
Okay, because a few weeks ago, I actually told Jen I need to talk to somebody.
All right, we'll get that taken care of for you. But you can always reach out to Dr. Strasberg's nurse
Okay.
in any event.
Yeah, no, I highly suggest if you have the ability to use the patient portal, that is monitored, quite often. So I always suggest patients to use the patient portal if they're having any questions or needing anything, because I know sometimes calling in or emailing is not the fastest way to get responses. So yeah, I like patient portal.
Thank you.
Anyone else?
Tanya?
Yes.
Hi, it's Callista.
Hello.
I did better this month than I did last month. I
Keep
don't
trying.
think it took, and I'm still not there yet, okay?
I think
But
you are.
I don't know. But I think this meeting that you're having is great because there's so many times I'm sitting in the waiting room and somebody will go, how long have you been a patient? So, I tell them 30 years. So it's very helpful to know you're not the only one and that somebody has been down this road before you. So that's very, very helpful. So I really enjoyed the subject matter, and the more the merrier. I wish you could get every net patient to join in, because I'm sure they have questions. So I just want to let you know it's great. Thank you for your hard work, because I know this is not easy.
Well, thank you. No, I'm glad you're finding this beneficial, and we're hoping that, with time this group grows and more people hear about this and start joining in, because like you said, nobody's alone. Nobody's experience is that unique, although everybody might feel that way. I'm sure there's somebody who's been through what each of you has been through in a different way and can relate and can have a conversation about it. So feel free to share these. We do have a Facebook, a Twitter. We're working on getting like an Instagram up so we can post clips and things, and trying to advertise as best as we can to get the word out. And if only one person is on, that's still a win. We're not complaining at all.
Well, see, not everybody does Facebook or Twitter,
right,
or Instagram.
Yeah, so we've got our little cards in clinic too. So trying to get the word out as best as we can.
Okay, thank you.
Thank you. All right, anybody else? All right, well, if not, we'll end a little early and give everybody about 20 minutes back of your day. Like I said, this will be posted on our website, on YouTube, so it'll be there for anybody to be able to access later or share. Thank you so much, Jennifer and Michael, for taking the time out of your day and having this conversation with us, and it was greatly appreciated.
You're very welcome. Thank you for inviting me. I think these are always positive.
Thank you. And it's same time next month. So we'll do the last Thursday of the month. Next time will be a conversation with our nuclear medicine folks. So we'll be touching on that. Thank you, everyone, and have a good rest of your day.
Thank you.
Thank you.
Bye, guys.
And thank you for all you've done for us.
Absolutely. Thank you.